Good afternoon, everyone. How we are doing? So, I'm here to talk on the topic hypoglycemia. Let's dive in. Okay, so hypoglycemia by pharmacy technician Adibola Economy Joel. So, we are going to be talking on the introduction, the causes and the risk factors, the elderly. Is hypoglycemia hereditary? What are the symptoms of hypoglycemia? Worsening signs, treatment, frequently asked questions, and what is our conclusion? Now, introduction. Low blood sugar, also known as hypoglycemia, is often caused by diabetic medications, especially insulin, or by not eating enough, especially when taking diabetic medications. Other causes include excessive alcohol consumption, certain illness, and hormonal imbalance. So let's go to the causes. Causes of hypoglycemia or the risk factors that can predispose a person to hypoglycemia. The first thing is a person using diabetic medications. Too much of insulin can actually lead to excess insulin in the body system. Then when insulin is produced, it will start reducing the amount of the blood sugar in the body, thereby leading to hypoglycemia. The next one is incorrect timing of medication. See on diabetic medication. When a person takes diabetic medication at the wrong time, it can possibly predispose the person to hypoglycemia. The next one is diet and lifestyle. A lifestyle and the diet of a person can lead to um hypoglycemia. The first one here is excessive exercise. When a person does exercise consistently, vigorous exercise can predispose a person to hypoglycemia, because whenever we do exercise or in our daily activities, we use calories. So when you use these calories excessively, the food in our body, carbohydrates are converted to glucose, and that glucose used by the body is counted in calories. So when you use them excessively and the blood sugar start reducing, it can lead to hypoglycemia. Another thing is not eating enough under this diet and lifestyle. If a person is not eating enough, it can predispose a person to hypoglycemia. Also, alcohol consumption. A person taking alcohol can also lead to hypoglycemia. Another thing is delayed or missed meals. When a person is delaying or is mixing meals, you are not fasting, but you just intentionally you are missing meals, you are skipping meals, it can predispose a person to hypoglycemia. Another risk factor is medical conditions. So we have three medical conditions that can predispose a person to hypoglycemia here. We have hormonal imbalance. The disorders of the adrenal and pituitary gland can lead a person to hypoglycemia. When these two glands are infected or they are having issues, can predispose a person to hypoglycemia. The next one is insulinoma. This is a rare disease of pancreatic tumor, and it can lead to production of insulin. So this is a disease of the pancreas. It is like having a tumor in the pancreas. So this disease will lead to excess production of insulin. Insulin will just be produced all the time, and this will lead to what? Hypoglycemia, which is also low blood sugar. The next one is bariatric surgery. This surgery is actually done for weight loss. So people take this surgery for weight loss, but most times most of those people who do this surgery end up having hypoglycemia, low blood sugar. So the other factors that can predispose a person to hypoglycemia is altitude. When you spend time at a high altitude, a high place, when you are a person that loves staying upstairs, you like high altitude areas, maybe you go to amusement park and you like to be spinned on the wheels all the time, you are predisposing yourself to hypoglycemia. Another thing is hot and humid weather. In our part here of the world, we are in tropic region Nigeria, our weather is hot, so it can also predispose us to hypoglycemia. So then puberty and menstruation. As one is entering into puberty, when the fluctuation in menstruation and puberty stages, puberty signs like deepening of voice, um because of these two signs also work with hormones. Puberty and menstruations deal with hormones. So due to the fluctuation, people sometimes they are not seeing their menstruation, sometimes it comes, sometimes it's 3 days, sometimes it's 4. Due to the fluctuation in these hormonal issues, if there are no if there is less sugar in the blood, it can lead to hypoglycemia. That is the reason why some ladies during their menstruation they will start craving for unnecessary ice cream and chocolate, because their body is asking for sugar so as to sustain the glucose being used in the process of menstruation. Now the next thing is the elderly. Now the reason why I'm going to this elderly majorly now is because in my vicinity I've counted about like 7 elders who just fainted and died as a result of hypoglycemia. So that was the reason why I picked this topic. So now let's look at the relation of the elderly to hypoglycemia. The older adults are more susceptible to hypoglycemia. They are very close to hypoglycemia. Why? Number one, taking someone else medication in diabetic medication and overdosing. You know, these are our elderly women now. Yeah, they'll be like, I'm having diabetes, you two are having, and I can use your drug now. You're using amlodipine 5 milligram. You're also using amlodipine 10 milligram. Ma worry, mama consume or ma lube, stuff like that. And not knowing that the way our body respond to drugs differs. Some people can even take it. Some people after taking the drug, they will not wait. Somebody is taking a drug and is expecting the effect immediately. Wọ́n say kíni oògùn ó dàgbé kò ṣiṣẹ́, you go and pick drugs. So taking someone else medication, most especially diabetic medication, and taking overdose can easily suspect older adults to hypoglycemia. So the next factor is medication. Medications, we have two major medications that can predispose adults, the elderly people, to hypoglycemia, low blood sugar, which is quinine. Quinine is used for malaria. It can also be used for cramps in some cases. So and pentamidine. Pentamidine is used for pneumonia in elderly. So these two drugs, when being used, can actually predispose and make an elderly person be a victim of low blood sugar. Another thing is dietary and lifestyle factor. One of the dietary and lifestyle factor of elderly that can predispose them to low blood sugar is skipping meals. Most of them are skipping meals, they are dodging meals. They say, ọmọ mi ò tí jẹun, my grandchild has not eaten, and there's food there. Some grandmas, they've given them food and they will wait until the food is cooked. Oúnjẹ yẹn ti gbóná jù. Some will intentionally skip meals without fasting and all that. This is predisposing them to hypoglycemia. Another thing under dietary and lifestyle factor is increased activity. We have old women that intentionally they will take hoes and weed all their surrounding, sweep, cook, do everything. They are even more hardworking than the present day youth. What some old women are doing, we that we were still young, we are trying to avoid it. So when an elderly person are involving themselves in much activity, their their body glucose is being used up and it can predispose them to hypoglycemia. Another thing under this dietary and lifestyle factor is malnutrition. So due to lifetime starvation, the rate of poverty in Nigeria, you see other women that are smelling, they might not have eaten for 3 days and all that. All this can predispose them to hypoglycemia.